Here are the top stories for today, April 9, 2021. Uphold patriotism and solidarity. President Rodrigo Duterte honors frontliners who reflect the heroism of World War II veterans as the country observes Day of Valor. In for a less strict quarantine status, the IATF will meet on Saturday to determine the fate of the enhanced community quarantine in the NCR Plus area. The Health Department suspends the use of Astrazeneca vaccines for people below 60 years old in the wake of blood clots among inoculated individuals. And no end to atrocities. Government troops seize some 53 anti-personnel mines used by communist terrorists in Camarines Sur. Good day, I'm Marita Muahe. Welcome to the PNA Newsroom. Our top story tonight, show greater patriotism and solidarity. President Rodrigo Duterte made this call as the country pays tribute to the heroes of the Second World War today, also known as Araw ng Kagitingan. In his message, Duterte said these values are needed, especially now as the country grapples with the COVID-19 pandemic. The president also praised frontliners who remain committed and dedicated in their duty to save lives and help the needy. He also says the heroism of the defenders of Bataan against Japanese forces reminds everyone of the Filipinos' unyielding determination to rise above any adversity. On April 9, 1942, American and Filipino forces in the front lines of Bataan surrendered to Japanese forces and were made to walk for some 140 kilometers on hot days without food and water from Mariveles town to Capas, Tarlac, which is known as the Death March. The Department of Agriculture explains that lowering the tariff on meat products is part of its efforts to bring down the prices of meat products. This as the government hopes to encourage importers to send more meat products to augment the supply in the country.
May kapangyarihan ang mahal na Pangulo under Section 1608 of Republic Act number 10863 na in the interest of general welfare and national security and upon the recommendation of the National Economic and Development Authority to increase, reduce, or remove existing rates of import duty. In this case, ay binabaan yung taripa ng imported pork effective immediately. So itong tariff rates include yung in quota ay 5% ang taripa, out quota ay 15%, good for 3 months.
Dar also said that the government considered everything to come up with a win-win solution between the government and the local hog raisers.
Approve po natin na MAP Plus ay doon lang sa deficiency natin itong taon gawa ng African Swine Fever. So, with this lowering of tariff at saka yung repopulation program na ongoing na, ay we believe na every stakeholder, including the citizenry in terms of affordable pork prices, ay win-win lahat ito.
Agriculture Secretary William Dar assures that the country has enough food supply amid shortage on pork products. He reiterates that the lower tariffs on imported pork is only good for 1 year to augment the supply in the country.
Ang ating bansa ay may sapat na pagkain sa mga commodities na ito. We have enough rice. We have now enough vegetables and fruits. We have also enough fish, different types of fishes in the market. Chicken ay more than enough.
Will the NCR Plus remain under ECQ or shift to a more relaxed quarantine classification? Malacanang says the answer will be discussed tomorrow, April 10. Presidential spokesperson Harry Roque said the Interagency Task Force for the Management of Emerging Infectious Diseases will discuss tomorrow the implementation of quarantine classification in Metro Manila and 4 nearby provinces after April 11. President Rodrigo Duterte has approved the release of 23 billion pesos worth of emergency subsidy to around 22.9 million beneficiaries affected by the implementation of ECQ. Each recipient can avail of either in-kind or cash assistance amounting to 1,000 pesos per person or 4,000 pesos per family. The government is also exhausting all efforts to address the issue of hazard pay of healthcare workers. Amid reports of slow processing of reimbursement claims, President Rodrigo Duterte has directed the Philippine Health Insurance Corporation to expedite their transactions and settle their payables to health care facilities immediately. Presidential spokesperson Harry Roque said PhilHealth has approved the application of a debit-credit payment method to facilitate the settlement of accounts payable to healthcare facilities. The state-run medical insurer received 107 billion pesos last year in claims for the service of hospitals to its members. It said it has already settled about 85% of these claims. PhilHealth CEO and President Dante Gueran said the delay was due to temporary lockdowns in their offices as some PhilHealth personnel have contracted COVID-19. The distribution of anti-parasitic ivermectin remains illegal even though the medicine was granted a compassionate special permit. The Food and Drug Administration says ivermectin is an investigational product and clinical trials on its use to prevent COVID-19 are ongoing. FDA Director General Eric Domingos said the hospital which applied for and was granted the compassionate permit for the use of ivermectin would be allowed to import, but they would be obliged to list down the patients who will be taking the drug and report its effects. The agency earlier approved ivermectin only as treatment from parasite infestation in animals. Filipinos seem to be more interested with the anti-parasitic drug ivermectin as well as possible sources of oxygen tanks than registering for COVID-19 vaccination. Meta search website iPrice Group said the numbers of Google searches on vaccine registrations, which is currently being promoted to usher the government's vaccine program, is 157 times lower than the searches on ivermectin and 27 times lower than searches on oxygen tanks. iPrice says the continuous upward trajectory of people's interest in ivermectin is very alarming as it shows that hospitals are experiencing a shortage of space and oxygen tanks and Filipinos are looking for worst-case scenarios. iPrice Group said Filipinos' online searches also reflects their need for treatment and security against COVID-19 as not all have the means to be treated in hospitals. More vaccines arrive in Caraga as the province continues its inoculation drive. Other provinces meanwhile set up more isolation facilities and vaccine hubs and testing areas to minimize the number of COVID-19 cases in their areas. More on this from William Theo.
About 36,000 doses of Sinovac COVID-19 vaccines arrived in Caraga region. This is in addition to the 59,740 doses of Sinovac and Astrazeneca vaccines that have been delivered last Tuesday, April 6. The Sinovac vaccines were formally accepted by DOH Assistant Regional Director Sadaila Raki at the Bancasi Airport. The vaccines are now stored at the cold chain facility in Barangay Duungan. In Tarlac, a mega vaccination facility is being set up in preparation for the mass inoculation of Tarlaqueños against COVID-19. The mega vaccination facility is located at the San Isidro Evacuation Center and can accommodate up to 1,500 individuals per day. The provincial government has allotted some 100 million for the purchase of the vaccines and will prioritize the indigent senior citizens. Meanwhile, hotels in Angeles City, Pampanga are designated as COVID-19 isolation hubs. The city government, through the help of the Hotel and Restaurant Association in Pampanga, designated Zero Garden Hotel, Diamond Hotel, and Sydney Hotel as isolation hubs for patients who are asymptomatic and with mild symptoms. They will be monitored regularly by health workers of the Rafael Lazatin Memorial Medical Center. And in Ilocos Norte, all entrants in the province may now opt for saliva testing at the provincial border checkpoints. The Philippine Red Cross in Ilocos Norte says the saliva test is good for 60 hours, just like the nasopharyngeal RT-PCR. It is pegged at 2,000 pesos per test. The COVID-19 testing centers at the provincial borders are ready to accommodate border crossers from 6 a.m. to 6 p.m. For the PNA Newsroom, I am William Theo.
Still to come, the DOH halts the use of Astrazeneca vaccines for persons aged 60 and below. We tell you later why. And business sentiments improve both in the first and second quarters of this year despite the ECQ in the NCR Plus area. More on this when the PNA Newsroom continues.
Alamin kung paano ang tamang pagsusuot ng surgical mask. Una, hawakan ang mask sa strap at siguruhing natatakpan nito ang inyong bibig at ilong. Tandaan, ang may kulay na bahagi ng mask ang dapat nasa labas. Ito lamang ang tamang paraan ng pagsuot nito. Ihulma ang nose piece o maliit na metallic strip ayon sa hugis ng inyong ilong. Iwasan ang paghawak sa inyong ilong at bibig. Kung marumi na ang mask, hubarin ito gamit ang strap at itapon ito sa isang basurahan. Siguruhin ang maayos na paghuhugas ng kamay gamit ang sabon at tubig. Ang surgical mask ay dapat gamitin ng mga pasyenteng may sakit sa baga o mga taong mayroong ubo, sipon at lagnat, mga nag-aalaga sa mga may sakit, at mga healthcare at frontline workers. Maaari ring magsuot nito kung kayo ay pupunta sa matataong lugar. Basta't sama-sama at laging handa, kaya natin to! Isang paalala mula sa DOH, PCOO, KBP at ng himpilang ito.
Many provincial government units implement stricter measure for those who are arriving from Manila and other areas with high number of COVID-19 cases. The details from Chris Crismundo.
At least 454 residents of Barangay Santa Peregrina in Pulilan, Bulacan received cash assistance. Beneficiaries receive a minimum of 1,000 pesos up to 4,000 pesos per family. The pilot payout was held at the Barangay Santa Peregrina Covered Court, facilitated by personnel of the Department of Social Welfare and Development in coordination with the local government unit. Beneficiaries from other towns and cities in the province will receive the same financial aid in the next 15 days. In Tacloban City, local officials step up their monitoring of arriving travelers, especially those who are coming from the NCR Plus and other areas with high cases of COVID-19. Travelers who show signs of COVID-19 symptoms will be referred to the Barangay Health Office for further examination and referral to the hospital or isolation units. Moreover, returning overseas Filipino workers are required to present a government-issued ID, while transient or visitors will be asked to present Bureau of Quarantine certification. The city government will also issue an acceptance certificate with an imprinted local QR code to every registered traveler and will be presented in the referral booth set up in terminals upon arrival. Meanwhile, people coming from Metro Manila are also being closely monitored in Bicol region. Legazpi City Mayor Noel Rosal has reminded all the region's barangay officials to closely monitor the arrival to prevent a surge in COVID-19 cases. Rosal, who has been designated as the COVID-19 ambassador for Bicol, said people attempting to gain entry to any of the 6 provinces of Bicol must be able to present valid documents, including results of either a negative reverse transcription polymerase chain reaction or saliva or antigen test. He also said that the IATF is planning to suspend flights from Manila to Legazpi to control the entry of people to Albay and other parts of the Bicol region. For the PNA Newsroom, I'm Chris Crismundo.
The Department of Health suspended the use of Astrazeneca vaccines for individuals aged below 60 years old. The Food and Drugs Administration recommended the suspension following reports of rare cases of blood clots with low platelets detected in some individuals inoculated with the vaccine. This after the European Medicines Agency identified blood clots as a very rare side effect of the AstraZeneca vaccine. To date, the National Adverse Events Following Immunization Committee has not received any local reports of such side effects. The DOH and FDA are carefully monitoring the rollout of vaccines to identify and appropriately manage any possible adverse events. FDA Director General Rolando Enrique Domingo meanwhile stressed that the benefits of vaccination continue to outweigh the risks. The National Task Force Against COVID-19 and the DOH reiterated that vaccination is safe and free. The Island Garden City of SAMAL and Davao City have started with Step 2 registration for the Philippine Identification System or National ID. The Philippine Statistics Authority spearheaded the registration held at the SAMAL City Gymnasium on March 27. PSA registration would be implemented from Monday to Saturday from 8 a.m. to 5 p.m. in identified registration centers. Mayor Al David Uy said the local government of SAMAL fully supports the national ID system because this benefits the general public. Earlier on March 24, Mayor Sara Duterte registered for the national ID, signaling the start of the Step 2 registration in Davao City. Socio-Economic Planning Secretary Carl Kendrick Chua said the national ID seeks to allow Filipinos, especially those in the low-income bracket, to access both government and private financial services. He said the national ID system is aimed to fast-track transactions with government and businesses. The Civil Service Commission has revised rules and procedures for the availment of maternity leave, paternity leave, adoption leave, and other leave privileges for civil servants. CSC Resolution number 210020 amended the Omnibus Rules on Leave to align its provisions with Republic Act 11210 or the 105-day expanded maternity leave law. This grants female government employees 105 days of maternity leave for live childbirth and 60 days for cases of miscarriage or emergency termination of pregnancy. The female worker may either extend the maternity leave for another 30 days without pay or use her earned sick leave credits for extended leave with pay. The resolution also allows for the proper filing of an application for paternity leave and entitlement to overtime pay in case his application for paternity leave is denied due to exigency of the service. Meanwhile, qualified adoptive parents in the government service can now avail of a 60-day adoption leave. In our business news, business sentiments improved in the first and second quarters this year despite the enhanced community quarantine in the NCR Plus bubble. Based on the latest Bangko Sentral ng Pilipinas Business Expectation Survey, the confidence index in the first quarter of 2021 rose to 17.4% from 10.6% in the previous quarter. Meanwhile, the index for the second quarter of 2021 rose to 42.8% from the previous quarter's survey result of 37.4%. Respondents based their enthusiasm on the easing of quarantine restrictions and reopening of businesses, adaptation to the new normal, hikes in the volume of sales and orders, the COVID-19 vaccine rollout, and the development of new business and marketing strategies. BSP Department of Economic Statistics Senior Director Redentor Paulo Alegre Jr. said optimism for the next quarter and the next 12 months is also on the rise. Alegre said it is still hard to determine the impact of the 2-week ECQ in the NCR Plus. However, respondents are adopting or developing strategies to adapt to the new normal. Up next, the United Nations expresses its full support to the government's vaccination program. And using vaccine passports, not so fast, as the World Organization says there is no enough data proving that it is an effective strategy. The PNA Newsroom returns after these reminders.
Alamin ang tamang paraan ng pag-ubo upang mapigilan ang paglaganap ng Coronavirus Disease 2019. Ugaliing magdala ng panyo o tissue. Kung uubo o babahing, takpan ang buong ilong at bibig gamit ang panyo o tissue. Kung walang dalang panyo o tissue, maaaring gamitin ang braso na pantakip. Kung nakararamdam na kailangan umubo o bumahing, agad na dumistansya sa mga tao sa paligid. Huwag dumura kung saan-saan, gumamit ng tissue at itapon sa basurahan. Ugaliin ang paghuhugas ng kamay at paggamit ng alcohol o hand sanitizer upang mamatay ang mikrobyo. Basta't sama-sama at laging handa, kaya natin to! Isang paalala mula sa DOH, PCOO, KBP at ng himpilang ito.
You're still watching the PNA Newsroom. The United Nations in the Philippines has declared its full support for the rollout of the government's COVID-19 vaccination program. Resident Coordinator Gustavo Gonzalez said he has mobilized all UN agencies to pool capacities, technologies, and resources in support of a successful vaccination campaign. The UN is providing logistics and technical assistance to help ensure equity and inclusion in the vaccination program. It is coordinating with the DOH and the Department of Justice to push for the inclusion of internally displaced persons and refugees, especially those belonging to priority vaccination groups in the national vaccination program. The UN is already supporting the Philippine government's vaccination program through the COVAX facility. It is also providing training to healthcare workers on cold chain management and COVID-19 testing while addressing misconceptions about vaccinations through information campaigns. In our news overseas, the World Health Organization expressed doubt over the use of vaccine passports or apps that show proof of vaccination against COVID-19 for travelers. WHO also said there is not enough data to suggest whether vaccines prevent transmission of the coronavirus. In a UN news briefing, WHO spokesperson Margaret Harris said not everyone has access to vaccines in many countries. Harris also noted the issue of equity, as well as pregnant women or children under 18 or large numbers of people who are immunosuppressed. As of April 5, more than 604 million vaccine doses have been administered, but overwhelmingly in developed countries. The COVAX facility has delivered 35 million doses to more than 78 countries. Some 14 former members of the CPP-NPA in Negros Occidental received financial assistance totaling 754,000 pesos under the government's Enhanced Comprehensive Local Integration Program, or ECLIP. The recipients, who are residents of Kabangkalan and Talisay and the towns of Hinubaan, Kawayan, Isabela, and Ilog, each received a check in rights held at the Capital Social Hall of Bacolod City on Thursday. They also got vegetable seeds, fresh milk, hygiene kits, and food packs. Governor Eugenio Jose Lacson thanked the former rebels for choosing peace as he acknowledged the challenges they faced before leaving the communist movement. Roslyn Quintana, OIC Provincial Director of the Department of the Interior and Local Government, said the government wants to encourage rebels to return to the fold of the law through the ECLIP. Government troops averted a possible attack by communist terrorists in Camarines Sur. This after they seized some 53 anti-personnel mines of the New People's Army. Captain John Paul Belleza, spokesperson of the 9th Infantry Division, said residents of Barangay del Carmen in Lagonoy Town reported the presence of NPA rebels in the area. After a 20-minute firefight with soldiers, the communist terrorists left behind 33 pieces of anti-personnel mines weighing 7 to 10 kilos each, another 20 pieces of anti-personnel mines weighing 4 to 5 kilos each, and several BOMO components. The Joint Task Force Bicolandia has denounced the communist terrorists' continued use of anti-personnel mines, which it says is a violation of both domestic and international laws. The Philippines joins Israel and the rest of the world in honoring the lives lost in the Holocaust in the commemoration of Holocaust Martyrs and Heroes Remembrance Day. Israel Ambassador to the Philippines Rafael Harpaz led the lighting of 6 candles to commemorate the 6 million Jewish lives lost in the horrors of World War II and the Nazi genocide. In a virtual ceremony on Thursday, Harpaz said the sufferings and death during the Holocaust serve as a grim reminder that there is no room for prejudice, injustice, anti-Semitism, and racism. He called on everyone to uphold everyone's right to live free from hate and judgment. Harpaz also hailed the late President Manuel L. Quezon, who saved a large number of Jews from the Holocaust. In the 1930s, Quezon decided to issue 10,000 Philippine visas to European Jews seeking to find refuge. For Harpaz, the so-called open-door policy of Quezon embodied the responsibility of a true leader. In sports, a Filipino former mixed martial arts champion Stephen Loman will not be seeing action at 1 on TNT3. Loman, the longest reigning champion of Brave Combat Federation, before moving to 1, reportedly contracted COVID-19 before he left for Singapore. One championship announced on Thursday that Tro Warden has replaced the Team Lakay standout as John Lineker's opponent in the headliners for the fight card scheduled on April 22. Loman's teammate Lito Adiwang was also pulled out of his match after he tested positive for COVID-19. Adiwang was scheduled to face Jared Brooks at 1 on TNT2, scheduled to be aired next week. Meanwhile, the entire Team Lakay delegation has been placed under observation following Loman and Adiwang's positive test results. Here's another look at today's biggest stories. Uphold patriotism and solidarity. President Rodrigo Duterte honors frontliners who reflect the heroism of World War II veterans as the country observes Day of Valor. In for a less strict quarantine status, the IATF will meet on Saturday to determine the fate of the enhanced community quarantine in the NCR Plus area. The Health Department suspends the use of Astrazeneca vaccines for people below 60 years old in the wake of blood clots among inoculated individuals. And no end to atrocities. Government troops seize some 53 anti-personnel mines used by communist terrorists in Camarines Sur. Thank you for watching another episode of the PNA Newsroom. To check more news content, visit our webpage or head on to the Philippine News Agency's Facebook and Twitter accounts. For more stories about the government and how it serves Filipinos, look for these hashtags in all of our social media platforms and websites. We are shown on the pages of the PCOO and its attached agencies. Also, watch us on television on PTV4 and IBC 13. And that's your daily dose of the biggest stories that you need to know from the PNA Newsroom. We tell stories that inspire change. I'm Marita Muaje. Have a good day.